Wales, where it's, as always, a lovely sunny day. Where are you today, Ros?
Down here in Nowra, and it's a beautiful sunny day on the south coast, but we've got the winds.
Ah, very good. The famous South Coast winds. Now,
Absolutely.
Katie and Amy are joining us in QI Community Central. And welcome Katie and Amy. Katie and Amy will be monitoring the chat box, which you can see on your screen there. Questions, please. We welcome your questions, and you can pop them into that box as we go along. We'll be monitoring them during the day. With 120 something people on the line, we won't be able to unmute people because we'll get a terrible background noise. But we monitor the questions through the chat box. So thank you for that. Amy's Tinkerbell going to move on to the next slide when she hears a little Tinkerbell noise. And Amy, see if that's working. Have you changed slides, please? So Ros, we're talking today about setting up a nurse clinic, and today we'll be dealing with the fundamentals of setting up a nurse's clinic. It's helpful, so that'll be great and welcome. Now, Ros, could you tell us a bit of the background of why you are interested in nurse clinics? What's your special expertise in nurse clinics?
Tony, I think my interest in nurse clinics is that they're an innovative model of care in primary health care that improve patient outcomes. And that's the drive and passion for nurse clinics, that they do improve patient outcomes.
And indeed they do. And you're currently working, Ros, at the Worrigee Medical Centre in Nowra.
Yes.
And you're also an academic practice nurse and have published a lot of papers and a lot of research into the roles of nursing in general practice.
Yeah, I wouldn't say that I've published a lot of papers, Tony. I have done some articles. I'm yet to actually cross that boundary, Tony, where you do some, academic research that's published. But hopefully, from our nurse clinic project over the next 2 years, we might actually get there.
Excellent. So, Amy, if we could move on to our learning objectives for today's session, we're going to all together learn from you, Ros, what a nurse clinic is and some of the fundamentals that go into a nurse clinic. We'll talk a bit about how a practice might be able to fund a nurse clinic, and then we'll have a look at examples of nurse clinics. We are going to have a second session, Ros, to look more closely at the implementation of nurse clinics in your practice. Is that right?
Yeah, Tony. Yes, absolutely. I think it's important that we look at one step at a time with the nurse clinic rather than trying to cram it all in at once.
Okay, so thank you for that. So we're familiar perhaps with nurse assisting doctors in chronic disease management, but the scope for nurse clinics to improve patient care in general practice and other primary care settings is quite large, Ros. So what are how would you define a nurse clinic?
I think the key definition of a nurse clinic is that the consultations are coordinated by the nurse. That's the clear picture that we need to have. But most nurse clinics are population health programs, and I think in the few years that we had our Medicare locals, they really drove home population health to us. So it's really important that we think about these concepts in either age groups or illnesses or preventive of illness. So they're also just an alternate way of organising appointments. Often we hear as nurses where GPs are uncomfortable with nurse-led clinics, and that's one of the reasons why we call them straight-out nurse clinics, but really it is just an alternate organisation of appointments for people that are coming to the practice anyway. It's always we have nurse clinics. They're a collaborative model of care. They're not exclusive for nurses. They actually encourage the whole team to participate. And the key factor here as well is that nurse clinics are person-centred focus. That is a key factor in the success.
So, as you say, Ros, we're learning more and more of it as primary care general practice changes from that episodic symptom-based. When the patients present, that's what we deal with it. We're moving into a much more proactive and systematic way of delivering care. And we talk about person-centered care, where we look at the whole needs of a patient and the families that look after them.
Exactly, Tony. We know, don't we, that there's a lot more than just the illnesses. There's all those social determinants of health with a person. And so we need to look at their physical needs and, have empathy and encourage them to become participants, engage them in their own healthcare so that they can share in decisions. And if we're doing this, we're actually working with people's beliefs and values. And this is a key to the successful outcomes of creating that therapeutic culture.
Certainly, Ros, and we know that the real work in primary care is that done by the families and the patients themselves, and the more we can help and support and teach and transfer the power to them to look after themselves, the better our outcomes will be. And so that leads to some of the benefits that we see from having nurse clinics.
Yes, Tony, and these, as we've started to speak, increase patient engagement and satisfaction. If a person wants to come back and see you again and they're proud of what they've achieved, you've really made some great achievements here yourself. So it's going to improve the outcomes. As we've talked about, the team care is enhanced. These are not exclusive for nurses. This is about the whole team. It nurtures professional growth for nurses because sometimes in general practice we can feel a bit constrained and not able to work to our full potential, and nurse clinics give us that opportunity. Of course, because we're looking at different models, that means that we start to think and see things differently, so we become more innovative and strategic in our ways. And importantly for everybody that's thinking about a nurse clinic, they contribute to the business model always. Sustainability is a key factor.
So, Ros, are these the skills in running a clinic for a practice nurse? Is that something that all nurses are going to be familiar with off the bat, or are these new skills, do you see, for nurses working in general practice?
I think, Tony, for the experienced general practice nurses around Australia, that these are not necessarily new skills, they are familiar skills to them, but nurse clinics aren't exclusive just to the more experienced and those that, are nurse consultants and stuff. And that's why we have these governance framework. We really need a robust framework that defines how we're going about this with the qualified nurse. So the qualified nurse doesn't have to have a master's degree. What they need to have is a passion for the area that they're moving into and they want to establish the clinic in, and also the educational background that has given them the expertise in that area to be able to negotiate. I think the new skill that all nurses kind of have to navigate here, Tony, is the negotiation. Negotiating with practice principals can be really tough, so that's a new skill. But we also need the resources, we need the consult room, and important as nurses that we have negotiated boundaries and defined referral pathways. That means that we know when we have to get help from someone else, when this is getting out of our scope of practice. And these are the documents that we use, the nursing codes and guidelines. And importantly, I think it would be good for everybody to have a look at the nursing decision framework flow chart that's on the NMBA, and that will help you in that area. Again, with nurse clinics, Tony, you're never going to be able to do it on your own. You need to gather up the friends and the supporters and get everybody on board that you can and find that strategic direction to push this forward.
So, Ros, that's inspiring. It sounds like there's a great leap in the way that general practice is organised from where it is now. So some early first steps for our for practices wanting to develop nurse clinics. How do we start?
I think it starts with the idea, Tony. Somebody that has the passion and has an idea and sees that something could be done in a different and maybe better way, that we can increase engagement and outcomes by changing the way we're doing things. And one of the key factors here in these very early days of a nurse clinic is to just Google, just to get onto Google and information, have a look around about what it is about the subject matter that you're looking at, and also what it is, you know, around the nurse clinics. There's a lot of information that is available. So ask your colleagues as well. See if you can start to get other people on board. Every person that you talk to, Tony, is going to give you a new idea or a newer way or an alternate. So it just keeps the ball rolling. You're moving along and you're starting to develop your team. You've always, as nurses, we know this is crucial. We need to go to the practice manager and have a chat with them and see how they feel about it. So much information will come from that one meeting, and you'll also get a good feel around whether or not this could be supported. But our practice managers are often the key person that helps us identify the sustainability. The most favourite one of mine, Tony, is to seek the wise counsel of friends. And you can see the group of friends here with the red wine, having a good old natter and chat and stuff. And these don't necessarily have to be the people or even nurses or the people that you work with. This is just a really good, safe group of friends that you have, and you know you can talk things through. They'll be honest with you and tell you whether you're on the right track. And as we've started to speak, then it's time to get ready to negotiate, because there's tough roads ahead, but nonetheless these are really important. Negotiating with principals is very difficult, but it is always inspiring. You get lots of questions so that it sends you off on the path of discovering more information.
Okay, so we'll be stealing shamelessly and ploughing our practice managers with red wine to get them on board.
Sounds perfect, Tony.
So, Ros, and we'll talk in a minute about the sorts of clinics, you know, examples of nurse-led clinics that you've seen used with success in general practice. But certainly one of the features of change is to have easy first steps that we've just discussed. But there's more to, your experience is more to getting change and having a good idea.
I think it's important that we use formulas and frameworks to help us continue to move forward, because there's going to be lots of speed humps. And the APNA workshop that for the Enhanced Nurse Clinic project, Dr. Richard Bills, a friend of the IF, he came along and he brought our attention to the change formula. It's really about that first step. You're dissatisfied with something, you know something could be done better, and if you multiply that by the vision and then by the first steps, that's going to be greater than the resistance. So the driving forces, the passion, needs to be greater than the restraining forces. And of course the early restraining forces that get put at us are things like sustainability. We don't have the room, how much is it going to cost, all those kind of things. But if we've really got the driving forces together, we can overcome all of these speed humps. And again, it's a group of people that you need to be with you here.
So dissatisfaction with the status quo needs to be high. We need to have a vision that has clarity. We need to have straightforward first steps so we can see our path, and all of that needs to be greater than the resistance we know will come our way, and then we've got a chance at change. And one of the first ways to overcome resistance is to bring your team, your practice team together, to engage the whole practice team.
Absolutely, Tony. It's really important that we have a collaborative whole team meeting. We need everybody to hear what it is that we're thinking about. We need everybody to have the background knowledge and the support. So bring everybody together and determine what the priority populations are for your practice. So there's no sense in saying we want to do a youth clinic if your practice population is an ageing population. So we need to be clear, and in the whole team meeting, often that's where other people will talk about ideas that they think could be potential priorities. It's really important for the project, for the Enhanced Nurse Clinic project, that you have a project leader. There must be an identified leader, one that has the authority to implement the plan. So that's a really important step, because sometimes we find managers and principals they feel a little bit uncomfortable if they can't kind of get in and do a bit of micromanagement, but we have to trust in our leaders here. We also need to agree on what the roles are going to be for the nurse. So what will the role of the GP, how will it be different? And what are we going to ask our admin staff to do? All these areas need to be nutted out first. This is also a good time where we identify what our education needs are. Do we need to learn more about wounds? Do we need to learn more about sexual health? And what are the courses available, so that we don't get almost to the stage of opening up our clinic, then realise the first person that comes in, we don't really know what we're doing here. So again, identify your supporters, and you're going to get them out of this team meeting. It'll be easy for the project leader to just sit and listen to everyone and find the supporters. And as always, Tony, the thing that we always push is that, you know, that robust reminder system. We have to know how we're going to do that and have that in place.
So Ros, I'm really keen to hear now about some examples of nurse-led clinics. We're familiar with, in our practice for some time, we've had nurse clinics in chronic disease management, where that's driven by the skills of our nurses. Used them also in our acute stream, but there are other examples that I haven't thought of. Where have you seen nurse clinics used well, Ros?
I think nurse clinics have been used very well around wound management, and as you said, Tony, chronic disease management as well. We often falter a little bit around the preventive health side of things. We're not sure how to make that sustainable, but preventive health is the future. That is what we need to start getting our heads around. Vaccination clinics, most practices do flu vaccination clinics these days. Well baby clinics are another beautiful one to support the community. What about women's health, men's health? What about patient education? We do well with our care plans, but what about the follow-up education? Could we kind of model that into a clinic? And thinking about Indigenous health, one of the most disadvantaged groups in the nation, if we can increase engagement and improve outcomes, that would be fabulous here, Tony.
Certainly, Ros, and I can see the need for improved systems of care, and the skills of nurses would add to that in all of those fields. One of the resistors that you're going to meet with is the way that these nurses are funded. We've lost our particular nursing item numbers in wound care and in immunisation, but there are other ways that practices can fund nurses working in perhaps non-traditional roles.
Absolutely, Tony, and we always turn to the MBS in general practice. And for those of you listening that aren't in general practice, you know, these are the minefields that we do have to navigate on a daily basis. But if you sit and think very clearly about the plan of how you're going to manage your nurse clinic, you can do as I did here with this slide, and I came up with all these potentials. everything that will help support us in our roles as nurses. Even though our item numbers, we know they are GP based, excepting the 87 and the 97, they are GP based, but most of these that we see on the screen are inclusive of nurse time.
Happy for you to run through some of those, Ros, and in a little bit more detail.
Oh, absolutely.
Some of them I'm not familiar with.
So we start up the top with our big ticket item numbers, and that's the 715. That's the Indigenous Health Assessment. We also have the 707, which is the 1 hour health assessment. If it's preventive, that would be like the 40 to 49 or the 45-year-old. And the 72123 is the care plan. Of course, sorry about that. We have, you know, the 705, 703, they're and the 701, sorry, they're all shorter health assessments. The 2700 series, they're the mental health item numbers for our GPs. So our clinic in particular is focusing on people with mental health. So that's why they're important to us. The 23s and the 36s, they're the normal, everyday, hard-working practice GP item numbers, aren't they? They're the ones that we use to support and sustain everything and the quality care that our GPs give. Down the bottom, of course, we've got the ECG, the Spiro, we've also got the Dopplers. So it's really about opening up your thinking and your mind as to what could be the item numbers that can support your clinic.
So nurses can contribute to all of those item numbers there, and in some of those item numbers, the nurse's time is included as part of the health assessment. For example, the nurse's time is included. In others, the nurse's time is not included for the time-nominated ones. I think the 23 and the 33. Unfortunately for us, the nurse's time isn't included in those item numbers, but many of them there, certainly nurses can make a major contribution to the consultation.
Absolutely, Tony, and this is important that we remember this as nurses. If there's a need for an ECG, for instance, then it's generally not the GP that would do the ECG, it would be the nurse. And of all the item numbers on this screen, it's only the 2700 series, the 23s and 36s, and down the bottom left, the 2501. They're the only item numbers on this page that are exclusive to GPs.
I think sometimes, Ros, when we're talking to our GP colleagues, they say, well, there's not an item number for the nurse to do this or that, and we point out, well, there's not an item number to have a receptionist, and there's not an item number for practice manager, and there's not an item number for a practice cleaner, but that doesn't mean that the GP tries to do all those roles. You want the right person in the right role, and using practice nurses to allow you to work more efficiently or effectively or even strategically, and to leverage the skills, the GP skills, and balance those with nurses' skills can be a really both profitable way to practice and make life easier for everybody and improve the health outcomes. It's not all just about whether it's a specific item number. In fact, there's some core funding that can support practice nurses working in general practice as well.
Absolutely, Tony, and it's often forgotten in the conversation because it is core funding, but the PNIP provides $25,000 per annum per full-time GP with an RM working 12.6 hours a week, and depending on where you live there can be loading to that as well. So that's a significant contribution that's already being made to our business models, and some of that funding can certainly help us, support us in our want to get a nurse clinic happening. There's also all the other practice incentive payments. If you were wanting to do a women's health clinic, then you would look at the PAP tip. You would look at the Indigenous, at the asthma and diabetes cycles of care if these are the areas that you want to work. And then of course there's facility funding. General practices these days are really strategic businesses, and you know, sometimes it's rent that you get for renting out particular rooms. We don't like to see our consult rooms empty. And for all those that aren't in general practice and might be working in areas where there's bulk funding models, this step here is really about how can we readjust or realign the funding that we have to help support us in this innovative practice. And that of course then brings us to that innovation funding. Innovation funding is available for a lot of different ways, and we've been really very fortunate with the nurse clinics because APNA on behalf of the government are running a two-year program on enhanced nurse clinics. And you can see here on the slide, as it says, it's funded by the Australian Department of Health under the Nursing in Primary Healthcare program. So it's not the nursing in general practice, it's nursing in primary healthcare. That's an important step. This program is delivered by the Australian the Australian Primary Healthcare Nurses Association. And of course, if you have the opportunity to join into a project such as this, one that APNA's running, of course your project gets supported by the experts that are there at APNA that might not have the answers and solutions to everything, but they're certainly going to give you another idea or a different path to go and have a look. And in this current project of 2 years, which only kicked off a few months ago, there's 11 clinics around Australia, and some of them are looking at blood-borne viruses, things like Hep C. There's some diabetes clinics as well. One of those is way out remote Northern Territory. There's dementia. There's refugee health. You can see this fabulous team here that are down here at the Bega Valley Medical Centre that with their big smiles and their teen clinic. They've been running that clinic for some time now, Tony, and you know, they're one of the groups that are really helpful in this program because of their knowledge. Then, you know, there's also a men's health clinic, healthy aging. These clinics are in general practice, correctional centres, you know, community centres, aged care facilities. So you can imagine when we were all in the room together with APNA for 2 days at a workshop in Melbourne, just how much expertise and knowledge and passion and drive was shared on those days.
Oh, it sounds most exciting. Another source of funding, Ros, may be primary health networks who have innovative funding looking for better models of care. For instance, ours funded practice nurses doing home visits to people's homes, a special item number for practice nurses to visit people at home, which proved to be very successful in preventing hospital admissions and caring with that person-centred approach. So if you have a good idea, you should take it to your primary health network, and you may find that they have funding to assist you in implementing that. Now, you've been involved in the Skip Into Life program, Ros.
And yes, Tony, thank you. This is our clinic, Skip Into Life, and it's a wellbeing clinic for people with mental illness. It's really about preventing, identifying early and managing physical illnesses in this group, because we know that people with mental illness are another disadvantaged group and their life expectancy is reduced, often because of physical illnesses. So what we are aiming to do is to engage people with mental illness in their physical health, to educate them so that we can empower them with the knowledge to enable the changes in their lifestyles that will help them live a longer and prosperous life. We look at family histories, lifestyle risk identification, harm minimisation, motivational interviewing, STI screening, vaccination, cardiometabolic monitoring, which is really important for people with mental illness, particularly the group that are on the antipsychotics, early detection of injuries and illnesses, and the management of the illnesses that are actually already there. So I think our listeners, our general practice listeners in particular, can see through their how we're looking to make this clinic sustainable.
And I can see, Ros, that to participate as a practice nurse in that clinic, you don't have to be a clinical nurse consultant in mental health. You need to have good general practice nursing skills. Is much more valuable, and that covers the range, that full range of activities that you've identified that the Skip Into Life clinic operates.
Absolutely, Tony, and it's an interest in mental health that I first started with, and we realised very quickly that we had quite a great need, and so I then coerced another experienced general practice nurse to join me so that we can run the clinic 2 days a week. And you can see here on this last slide in particular, the group over here on the left, they're our magic credential health mental health nurses, and they organised this training day where we were able to go together, and this was all about trauma-informed care. So you can see Scott on the left over here with the glasses. He's our most senior credentialed mental health nurse, and over here on second from the right, that's Julie, who's my colleague that's doing the work with me. But I really want to point out here, Tony, that, you know, over to the right, far right, that's Dr. Howe and Annette Pham. They're our practice principals, and don't let those beautiful smiling faces fool you. They're very tough negotiators. But importantly, Tony, this is the way we are greeted for every negotiation, and this is the way that we conclude the negotiation, with the friendly, welcoming smiles, so that you know that you're safe and everything's going to be all right. But correct, Tony, you don't need to be the absolute expert. You just need the passion to be able to go and find the education that's required.
So fantastic, Ros. And so when we meet for our webinar, our next part 2 of this webinar, which is about a bit more practical, some further practical advice about implementing nurse clinics. In the meantime, you've got some homework for our participants, and I might also add that, and this is Katie, we might send everybody the links to, Ros and I have previously done QI community webinars on best practice in care planning for fun and profit, and that was 2 one-hour sessions on the mechanics and skills required and some templates for doing care planning. They're available on the Vimeo, and people may like to look those up. If you could find the links for those, Katie, and share it with people.
Certainly will do, Tony.
Katie, what's coming up soon in QI community webinar?
Thank you, Tony, and thanks, Ros. That was great. So we will look forward to hosting Ros and Tony again in September on the implementation of nurse clinics. So keep an eye out for that one. But the next month's webinar will be working with Professor Susan Curl, who is a professor in healthcare and older people at Sydney University and a practicing geriatrician. And she will be guiding people through the essentials for good care of patients with dementia in general practice. So if you have an interest in aged care, please make sure you come along to that one. And also, if you're interested, we are now running a new series of online seminars to help to train you to become a quality improvement practitioner fast. So you can pick and choose topics to attend from those on the screen in front of you, or attend all the sessions if you're interested. This series is designed for people who are new to quality improvement and or those who'd like a refresher. And this series will teach people how quality improvement can build a culture of high performance in your general practice or health service, how it can help you to deliver better services, and also importantly, maintain and increase your profit margins. Each session costs $50 and starts at 1 p.m. Australian Eastern Standard Time. So please share this information with your colleagues and others who you think will be interested in starting out on their journey into quality improvement.
Thanks, Katie, and thanks, Ros. Look, you've certainly opened my eyes up to the enhanced role that our nurses could have in different non-traditional clinics in our practice, and will start to drive some change or some improvement in that regard, and look forward to catching up once again in September. You're always full of good advice. So thanks for joining us, Ros, and thanks to all those, the many people who attended today. We'll try and keep in touch with you and be part of the team that Ros talked about to support you through the improvement. Katie, you're in charge of securing the red wine. The notes will be available. So Ros's slides will be made available for all. And I'll hand over. Thank you, Ros. And Katie, how do people grab the slides? What's the procedure going to be?
Okay, so what we will do is when I send the information on the care planning QI community webinar that you held before, the link to that, we will also make this PowerPoint presentation available to you in that group email, Tony.
Great. Terrific. So thanks, Ros.
Thanks, Tony. Thanks, Improvement Foundation, and thank you to everyone for listening.
And thanks, Katie and Amy down at QI Community Headquarters. And remember, when you close your window now, an evaluation form will pop up. You're welcome to include in that questions you want to make sure that Ros addresses in our next webinar. So thank you for attendance, and we look forward to evaluations. See you, everybody. Bye-bye.
Bye.
Thanks, Tony and Ros. Bye.
Bye. Katie, are you there?
Hi, Ros. We certainly are.
Oh, did my coughing come through?
Only a very, very tiny bit. I just wished I was there to give you a glass of water.
I had the glass of water, but it was just sitting right there at the back of my throat. I'm so sorry.
No, not at all. That was fantastic. It flowed so well. Yeah, it was really good. It was great.
Excellent.